Hello, everybody. We are on day 88 of the 90-day free NCLEX review series, and we are also inviting you to enroll to our NCLEX review at NCLEXcoaching.com. And today we'll continue tackling the Q&As, and this will be all about the assistive devices. And so let's get started. Question number one, it says here, a nurse is preparing to teach a client how to use crutches safely. Which assessment should the nurse prioritize before beginning this teaching session? A, the client's anxiety about using crutches. B, the client's understanding of the need for improved mobility. C, the client's muscle strength and previous activity level. And D, the client's thoughts about limited mobility. Your answer should be letter C this time. That's assessing. Okay, sorry, this is actually the correct answer here. It's to make sure that you are assessing the muscle strength and previous activity level. Okay, just to verify, that's letter C. It's very important for us to make sure that we are able to identify the client's physical readiness regarding the use of the crutches, and this will help us evaluate whether the client can support weight and also their balance safely. Remember that when a patient is going to use crutches, they need to have good upper body strength in order to reduce their risk of having the falls. Okay, now if you selected letter A, the client's anxiety about using crutches, this is somewhat relevant, but it doesn't really take priority over the physical capability that is needed when they're supposed to use the crutches. Now, if you selected letter B, client's understanding of the need for improved mobility, this may support motivation, but it does not directly impact the client's immediate physical safety when they're using the device. Now, if you selected letter D, client's thoughts about limited mobility, these are somewhat relevant to the emotional adjustment process, but not going to be the primary assessment, especially that you're going to promote this patient to use the device pretty soon. Now, your keyword here is the priority. It suggests focus on the immediate safety, and we need to make sure that there is a level of readiness which should align with their physiological needs as well. Now we're going to have to prioritize those psychological needs after we have met that physiological need. Let's have number two. After sizing a client for crutches, how can the nurse confirm that the crutches fit correctly? Is A, the elbow is bent at a 30-degree angle when holding the hand grip? Rests on the crutch pad while standing? Or D, the elbow remains fully extended when gripping the crutch? This is a basic question. Your answer here should be letter what? Should be letter A. Make sure that there is that 30-degree elbow bend to ensure that the weight is distributed through the hands. Okay, so this will avoid pressure on the axilla, and it will help better control the movement with the crutches, of course. Now, if you selected letter B, the crutch top is positioned close to the armpit. Take note that this can lead to the nerve damage from excess pressure on the axillary nerves. This should not happen. So B is incorrect. If you selected C, this can allow the axilla to rest on the crutch pad, and this can also compress the nerves. It's not going to be a proper fit. Now, if you selected letter D, elbow remains fully extended when gripping the crutch. Well, if you're going to keep that elbow straight, it will not allow for safe arm movement, and it could hinder the balance as well. So make sure that you teach this patient to make sure that they do this 30-degree angle when they're handling the hand grip. Okay. Remember about the positioning. 30-degree angle. So take a look into the photo right here. Look at the angle of that elbow while he's holding the hand grip. This should be maintained to also allow stability when they are shifting the weight. Okay, let's have number 3. A client with partial hemiplegia on the left side requires more support than a standard cane. Which assistive devices could provide adequate stability? Select all that apply. A. Tripod cane. B. Wooden crutch. C. Quadrupod cane. D. Walker. E. Wheelchair. F. Lostron crutch. Hi everyone. Welcome to our session today. So you're selecting more than one option in this question. Which assistive devices could provide adequate stability? So your answer should be the following. Options A, C, and D. Those are your tripod cane, quadrupod cane. You also have the walker. Why tripod cane? Because it has a 3-point base. It can increase the stability compared to a standard cane. And if you selected the letter C, quadrupod cane, it has wider base of support. And this is more ideal for those patients with partial lower body weakness. And if you selected letter D, it offers much more of comprehensive support. It can allow the patient to have much more weight distribution across the multiple points. Now, if you selected letter B, wooden crutch, it does not provide sufficient stability for partial weight bearing patients, right? Now, if you selected letter E, wheelchair, this is going to reduce the patient's independence. It's not ideal for a patient to be able to bear partial weight on the affected leg. So eliminate wheelchair right away. And then if you selected letter F, Lostron crutch, again, this is something that is more suited for clients with bilateral weakness and rather than unilateral weakness from hemiplegia. So here are your quadrupod cane and your Lostron crutch. All right, so here you need to eliminate those options that can reduce the patient's independence. So take away letter E with the wheelchair and remove those that are intended for different support needs, such as the crutch. And you got to focus here on those devices can properly support the patient. Wider base of support. You can't hear well? Oh, I'm sorry. What's going on? How about the others? Can you hear me okay? I actually have my volume set at max right now. Can someone please check if you can hear me well? Can somebody message? Yeah, I have my full volume. Let me adjust. Try this. Okay, getting the microphone as closer as it can. Okay, all right, let's move on. Number 4, the nurse is instructing a client with a fractured leg on how to perform partial weight bearing with crutches. Which action indicates the client is following the weight bearing restriction correctly? A, bearing 30 to 50% of the weight on the injured leg. And B, avoiding any weight on the right leg. And C, letting the right foot touch the ground without bearing weight. And letter D, bearing 60 to 80% of the weight on the injured leg. All right, what is your answer here? You're supposed to instruct the patient with a fractured leg how to perform partial weight bearing with the use of crutches. So which of these options here indicates that the following option, or indicates that the patient is following rather the weight bearing restriction. That should be letter A, bearing 30 to 50% of the weight on the injured leg. That is so obvious. With the partial weight bearing, it will allow the patient to place about this much of weight, 30 to 50%, on the affected leg. This is prescribed by the healthcare provider. It's not something that we decide. No, this is something that is specifically prescribed by the medical provider whenever there is progression in their level of activity. And this is something that can promote safe mobility while protecting the healing of that fracture. Now, if you selected letter B, avoiding any weight on the right leg, take note that our affected leg here, is it something about, it is not specified, but anyhow, avoiding any weight on the right leg, this approach really aligns with non-weight bearing. So it's not really consistent with a partial weight bearing guideline. So we are going to allow some weight, at least partial, or let's say half of the body weight. Now, if you selected letter C, letting the right foot touch the ground without bearing weight, this is what we call as touchdown weight bearing. And this is much more of a stricter guideline than partial weight bearing. So basically, you're not allowing the patient to even bear weight on the affected extremity. Again, this is much stricter guideline. Now, for letter D, bearing 60 to 80% of the weight on the injured leg, this is exceeding the partial weight bearing guideline. So this is a big no. This will cause excess stress on the fractured extremity. Okay. Now, when you encounter a test question that will ask you about partial weight bearing, it suggests that you should select those moderate weight allowance. Okay, so here we have our value, 30 to 50%. That would be your clue. Let's have our next item. The nurse reviews with the client the technique for sitting down and standing up with crutches. Which actions are correct when transitioning from standing to sitting? Select all that apply. Good to hear that, Maria. Very good. For those who just came in, welcome to our session today. Again, which actions are correct when transitioning from standing to sitting? Select all that apply. Is it A, move the crutches to the affected side for balance? B, place the unaffected leg against the front of the chair? C, flex the affected leg and keep the unaffected leg straight as they lower? And D, grasp the armrest on the chair with the hand on the unaffected side? And E, position the crutches in front to lean on as they lower themselves. This is quite a basic question regarding lowering themselves with the use of the crutches. This is a select all that apply. Take note, this is select all that apply. Your answers here should be letters A, B, and D. All right, so this is to allow the patient to move the crutches to the affected side. This will provide balance and stability. And if you selected letter B, place the unaffected leg against the front of the chair, this is one of the preliminary steps in positioning the unaffected leg. And this will add stability and also control when they will start to sit down. Now, if you selected letter D, grasp the armrest on the chair with the hand on the unaffected side. This will give them better support on the unaffected side, and this will help the client safely lower themselves. If you selected letter C, flex the affected leg and keep the unaffected leg straight as they lower. This is actually not safe for them to do. The unaffected leg should be bent while the patient starts lowering. Okay. And letter E, position the crutches in front to lean on as they lower themselves, this can destabilize the patient. Instead, they should rely on the armrest for support when sitting down. So here's the deal. Okay, so when you're going to assist the patient to sit down with the crutches, what you need to recall will be to position first. Make sure that you're going to guide the client to stand directly in front of the chair, which is in our first box. And of course, make sure that the back of their legs will lightly touch the edge of the chair. Okay. The next step will be to instruct the client to hold the crutches on one side. All right. So what's going to happen here is to have them hold both crutches in one hand, usually the side of their unaffected or stronger leg. And this is also, they should grab the crutches by the hand grips for stability, okay? So it could be either, so you just need to switch into that, what do you call this? Switch the crutches to that particular side, and then what's going to happen here is to allow the stronger hand or the side which is unaffected, okay? They're going to have to reach for the bar or the handle of the chair. The one that's not holding the crutches to reach back for the armrest, or in order for them to allow to lower themselves into the chair. Now, the next step here is to have them lower slowly. And this is to ensure that they can use their arm on the chair for support while keeping the stronger leg stable. And they're going to have to gradually do that sitting position by bending the stronger leg. Okay? Make sure that you allow them to bend the stronger leg this time. Okay? And once they're seated down, they can now place the crutches nearby so that then they can reach it whenever they have to get up onto, of course, when they have to leave or the chair. Now, the next positioning here, when they're about to leave the chair, or when they're going to position themselves from a sitting to a standing position, your sequence should be like this. So it's exactly the reverse. You're going to allow the patient to position themselves. So you're going to help them move to the edge of the chair, or instruct them to move at the edge of the chair, and to make sure they keep their stronger leg in front. That is your P for the position. Now, next is to make sure that they will place both crutches on the side of the weaker leg and hold the hand grips with one hand. And then followed by making sure that they do the leverage, using the other hand to push against the armrest or seat for support. And then this is to be followed by making sure they have the crutches into the position under both arms. So make sure that they have that to stabilize while they are ready to stand up. So don't forget about the sequence when they're standing. That's your PHLC, position, hold, leverage, and making sure the crutch are held into position. All right. Now let's go into our next test question, number 6. The client reports of numbness and tingling in the hands and arms. Raise concerns about improper crutch technique. Which responses by the client indicate an understanding of how to minimize this risk? Select all that apply. A, I'll check to ensure there's a small gap between my armpits and the crutch pads. And B, I'll take breaks if I feel any numbness or tingling in my arms. C, I should press down on the crutch pads to prevent shoulder strain. And D, I'll adjust the crutch height so my elbows are straight to reduce strain. And E, I'll place weight on my hands and keep my armpits away from the crutch pads. Which of these options should be your answer? you should select the following options, letters A, B, and E. Letter A can ensure that there's a small gap between the armpits, and it will reduce the pressure on the brachial plexus. And if you selected letter B, I'll take breaks if I feel any numbness or tingling in my arms. This is to relieve the pressure on the nerves. And to select letter E, I'll place weight on my hands and keep my armpits away from the crotch pads. Now, bearing weight through the hands rather than the armpits can prevent the nerve compression. This is something that you should emphasize when your patient is just starting to use the crutches. Do not let them allow to rest their armpits on the crutch pads. Make sure that they maintain the use of their hands on the hand grips with that 30-degree angle. Okay. Now, why not letter C? I should press down on the crutch pads to prevent shoulder strain. What can happen here is that when you're doing this, pressing down on the crutch pad, it can cause nerve damage due to axilla and should be avoided. Okay. Crutch pad basically is the one that it's next to the armpit, so it should be avoided by the patient. If you selected letter E, or letter D rather, I'll adjust the crutch height so my elbows are straight to reduce strain. Again, this is not appropriate because this will not allow that 30-degree angle of that elbow. This is causing that elbow to be extended. Remember, there should be at least 30-degree flexion of the elbow. And this will allow them to stabilize themselves and better control in positioning themselves and holding the hand grip. Let's have number 7. The client will need to navigate stairs at home. Which instructions should the nurse provide to ensure safe crutch use on stairs? Select all that apply. When going upstairs, lead with the unaffected leg first. B, when going downstairs, move both crutches down before the affected leg. C, use the unaffected leg to help lower body weight when descending. And D, always move the crutches and affected leg together first when going up. And E, hold onto a handrail if available and keep the crutches on the opposite side. And take note, your patient is about to use the crutches using stairs. So which of these would be the safe method of navigating themselves? Select all that apply. The correct answer here is what? Letters A, B, and E. Letter A. Why letter A? When going upstairs, lead with the unaffected leg first. This will help maintain stability and control. Letter B. When they're going down the stairs, both of the crutches should be navigated first. This will ensure that there is stability and support as they are going to head down. Now, for letter E, hold onto a handrail if available and keep the crutches on the opposite side. This will also add stability and control. And while positioning the crutches on the opposite side, this can also distribute the weight. Now, if you selected letter C, use the unaffected leg to lower body weight when descending. This is unnecessary and this can cause loss of balance. The crutches and the affected leg should go down first. Take note of that. When they're going down the stairs, crutches and the bad leg should go down first. When they're going upstairs, the unaffected leg should go up first. All right, please remember that. So here's our thing. To easily recall about navigating themselves with the use of the crutches when they are going upstairs. That's your mnemonic. Good goes up, or bad leg stays down. So you want to make sure that the patient will step up with a strong leg first. Okay, and then they're going to follow that with bringing the crutches, and then this will be followed by the movement of the weaker leg. So take a look into the sequence right here. Okay, now when they're going downstairs, you can remember bad goes down, good follows. So what should happen here is to move the crutches down first, together with the bad leg, and then followed by the stronger leg. So when they're going down, there should be better support, stability. Okay. Now let's have our next question, number 8. The nurse reviews the 3-point gait with the client. Which steps demonstrate the correct use of a 3-point gait with crutches? Select all that apply. A, advance both crutches together, then move the affected leg forward. B, bear weight on both crutches, then move the unaffected leg forward. C, advance the unaffected leg, then bring both crutches forward. And D, repeat the sequence of weight bearing on both crutches, then the unaffected leg. And E, keep the affected leg slightly raised and avoid placing weight on it. We are talking about a 3-point gait. So what would be those options? Your answer should be letters B, D, E. Why letter B? Weight bearing both crutches, then move the unaffected leg. This is the correct technique in a 3-point gait. This has been the sequence, right? Again, the sequence here is to bear weight on both crutches, then you're going to have to move the unaffected leg. Okay. Now, if you selected letter D, repeat the sequence of weight bearing on both crutches, then the unaffected leg. This is also part of your sequence. Now, if you selected letter E, keep the affected leg slightly raised and avoid placing weight on it. This is very important, especially for those patients who cannot bear weight on one leg. Okay. And if you selected letter A, this is incorrect. Advance both crutches together, then move the affected leg forward. This is not the standard sequence. The unaffected leg should move separately after the crutches. Okay. Now, if you selected letter E, keep the affected leg slightly raised. I'm sorry, letter D rather. Am I reading the wrong one? Letter C. If you selected letter C, which is one of the incorrect answers rather, advance the unaffected leg, then bring both crutches forward together. What should be the sequence here instead is you should advance the, this sequence alone is going to destabilize the patient. What should happen here instead is advance both crutches together first. Okay, then the affected leg. Let's have this one. Okay, so let's recall about the 3-point gait. What is really the purpose of the 3-point gait? This is intended for those people who can only bear weight on one leg. Take note of this. What's going to happen here is that both crutches should be moved forward. Then the strong leg follows, or what we have as the unaffected leg. So what you should recall here is to remember 3 points, which simply means both crutches plus the one leg. This will hit the ground at the same time. So here's your sequence. You have your crutches move forward and followed by the unaffected leg. Of course, the other leg that is affected is not shown because it's not supposed to bear weight. Okay, so it's only the unaffected leg shown in this diagram. Now let's have our next test question, number 9. The nurse is instructing a client on how to properly position their crutches while standing. What guidance should the nurse provide regarding where to place the crutches? A, position the crutches 3 inches in front of and to the side of the toes. B, position the crutches 6 inches in front of and to the side of the toes. C, position the crutches 15 inches in front of and to the side of the toes. And D, position the crutches 20 inches in front of and to the side of the toes. There's so many distractors. Your answer here should be letter B. Position the crutches 6 inches in front of and to the side of the toes. This will align with a classic tripod position. So don't forget about this. Tripod positioning, this will allow for a much more stable base for this patient. This is very important for them to safely navigate getting that step forward. Now, if you selected letter A, position the crutches 3 inches in front and to the side of the toes. This is insufficient. The distance alone is very short, or very, the narrow distance will not provide adequate base of support. So you got to eliminate this one. If you selected letter C, position the crutches 15 inches in front and to the side of the toes. This is way too far from the toes, and this is way too excessive. And this will cause instability into the gait. So you're going to have to eliminate that one as well. And same thing with letter D, 20 inches in front and to the side of the toes. This will really destabilize the patient. It will put them at risk for falling. So remember the standard tripod position. You're going to have to use that 6 inches in front of and to the side of the toe. Okay, that is the standard approximation in placing the crutches while they're standing. Let's have a number 10 afterwards. So here's the deal. When you're doing the when you're starting to have a patient use their crutch, or before you're going to have to initiate that, make sure that there is proper measurement of the crutch. So this is to prevent for the injury of the brachial plexus. Again, there should be at least 2 to 3 finger widths. There should be that space between the crutches and the axilla. So take note of that. The armpit should not rest into the crutch pad. Now, what's going to happen here next is to make sure that you educate them to allow flexing of at least 20 to about 30 degrees angle when they're using the crutch. Next is when you're starting to help them use this device, you need to stand on the patient's affected side, and you're going to instruct them to avoid resting their armpits on the crutches and make sure that they look forward, and you're going to have them place the crutches with this range. This is within the safe range, 6 to 10 inches in front. Anything beyond 10 inches would destabilize them. Okay, so in that scenario that we just had, it was 6 inches. It's also correct, but if in case you're going to encounter a case scenario wherein it's about 10 inches, that is still within the allowed position. So here's our tripod positioning here. When stabilizing themselves while standing, make sure that the crutches will be within this distance. Okay. Let's have our next item. Number 10. A 68-year-old patient with left hemiparesis following a stroke is learning to use a quad cane for ambulation. The nurse observes the patient using the cane and provides instruction to ensure proper technique for safe mobility. Which of the following is the correct technique for the nurse to use in teaching the patient? A. Use the cane on the right side with the cane moving forward first. B. Use the cane on the left side with the left leg moving forward with the cane. C. Using the cane, or use the cane in either hand with the right leg moving forward first. And D. Use the cane in either hand with the left leg moving beyond forward placement of the cane. Take note in our scenario, it says here that the patient has left hemiparesis after a stroke. So patient now is learning to use the quad cane. So what would be the best technique here in order to prevent any possible fall? Your answer should be letter A. So using this way, especially having that on the right side with the cane moving forward first, this will allow the left leg to move forward with the cane. And this will help stabilize, and it will also help with the balance and mobility, which will promote safety. Now, if you select letter B, use the cane on the left side with the left leg moving forward with the cane. Well, this is a red flag. It doesn't provide adequate support to the unaffected side during ambulation. If you selected letter C, this is also incorrect. It lacks the specific technique for moving the cane with the leg, which is very important with the balance. So moving the right leg first without proper cane placement, this can lead to the patient's fall. Now, if you selected letter D, use the cane in either hand with the left leg moving beyond the forward placement of the cane. This is an improper weight distribution, and this can also lead to instability. All right, so let's recall the concept. Oh, I thought that I had the picture. Anyway, I'll show you that one in a minute. Question number 11. A nurse is teaching a patient recovering from a leg injury how to use a 3-point crutch gait. The patient has limited mobility and requires clear instructions for safe ambulation. When teaching the use of a 3-point crutch gait, the nurse should instruct the patient to move A, both crutches and the affected leg first, then the stronger leg, B, the right crutch, left foot, left crutch, and right foot in sequence, or C, the left crutch and right foot, then move the right crutch and left foot, and D, both crutches, then lift and swing the legs forward as far as the crutches. We're using a 3-point gait right now. So what would be that option? This should be letter A. Both crutches and the affected leg first, then the stronger leg. This will help maintain the balance, allow the patient to use the stronger leg for allowing them to propulse after. If you selected letter B, the right crutch, left foot, left crutch, and right foot in sequence, again, this is a huge factor of destabilizing the patient's gait. This will not allow support. If you selected letter C, the left crutch, right foot, then move the right crutch and left foot, again, you're not going to be able to allow the patient to get much support this time. It will increase their chances of falling as well. And D, both crutches, then lift and swing the legs forward as far as the crutches. This is not the specific way of using that 3-point gait. Imagine swinging the legs forward as far as the crutches. This is not even part of the swing through gait. A huge red flag. It will not allow the distribution of the weight. Exactly will destabilize the patient. Alrighty, number 12. A nurse is instructing a post-op patient recovering from a broken leg on how to use crutches effectively. The patient needs clear guidance on the best gait to facilitate mobility and recovery. Which crutch gait is most appropriate for this patient? The patient is post-op, recovering from a broken leg. So, would that be A, 4-point gait, B, 3-point gait, C, 2-point gait, D, swing to gait? Your answer should be letter B. The 3-point gait can allow the patient to keep weight off the affected leg while they start to move. So this is the ideal post-operative technique to use for this patient. If you selected letter A, 4-point gait, This is more appropriate for those patients that are more stable. This is not suitable for those patients requiring complete weight bearing support on one leg. If you selected letter C, 2-point gait, this will also require more stability and also coordination. And this is not appropriate for this patient just recovering from a broken leg. Okay. And if you selected letter D, swing to gait, this is much more appropriate for those patients that have already gained upper body strength. They're more skillful to actually do this type of gait. So this is not appropriate for this patient who just had that surgical procedure. Okay, this is going to require much more skill. Again, they need to have that good upper body strength and control. Let's have number 13. A patient with a leg injury is being fitted for a cane to assist with mobility. The nurse needs to ensure that the patient understands the correct use and positioning of the cane. The patient should be taught to A, hold the cane on the uninvolved side, B, hold the cane on the weaker side, and C, extend the cane 15 inches from the foot when used, and D, maintain approximately 60 degrees of elbow flexion. Your answer here should be letter A. So, holding the cane on the uninvolved side will best support the entire body and also the weaker leg, much more stable here. If you selected letter B, hold the cane on the weaker side, this will compromise the balance, much more difficult to initiate the ambulation this time. If you selected letter C, extending the cane 15 inches from the foot when used, this is excessive. It should be held closer to maintain better control and stability. Now, if you selected the letter D, maintain approximately 60 degrees of elbow flexion, this is not ideal. 60 degrees of elbow flexion is excessive. What we should expect here should be 15 to 30 degrees of elbow flexion to allow optimal support. Okay, remember, for the use of the crutches, the elbow should have at least 20 to 30 degree angle, okay, that elbow flexion. When a patient uses a cane, they need to have that 15 to 30 degrees elbow flexion as well. Please remember those facts. So let's have a quick review regarding the use of canes. So here we have, especially when you are going to allow them to position in a standing position, remember this mnemonic: cane opposite affected leg. Use this mnemonic, hold. So the cane should always be held on the opposite side of the weaker leg. That's the positioning here. Next, you have to recall about the handle level. So you need to think about the greater trochanter as the key reference point. So this is where the handle should align. All right. Now, what you need to think next is about the elbow flexion. So the patient is supposed to have that 15 to 30 degree angle. And this is that flexion of the elbow in order to maintain comfort and balance. Not extended, but have that 15 to 30 degree angle. And then make sure that they maintain that movement sequence. So the sequence should be cane and weaker leg together. This will help you in remembering that the cane and the affected leg move together for support, and then followed by the unaffected. And one last thing about the concept about the use of the cane: make sure that your patient is going to do periodic checks on the rubber tips in order that they'll be able to have proper traction on the ground. Make sure that they do that. If they're going to see any wear and tear, this needs to be fixed right away in order to maintain balance. Let's talk about number 14. A patient who has been using crutches for the past 2 weeks returns for a follow-up exam. During the visit, she reports experiencing tingling and numbness in her hands and upper torso. The nurse needs to assess potential causes of these symptoms related to crutch use. Possible causes of these symptoms are A, the patient's elbows are flexed 15 to 30 degrees when using the crutches. B, crutch pad is approximately 2 inches below the patient's axilla. And C, patient holds the cane 4 to 6 inches to the side of her foot. And D, hand grip does not allow for elbow flexion. We are being asked here for possible causes of these symptoms. It's a multiple choice, not a select all but apply. The correct answer here is letter D. Hand grip does not allow for elbow flexion, because if the patient is not maintaining that 30-degree angle, this will increase the pressure on the nerves of the arms and also the hands. That's why the patient's feeling all these weird sensations, the numbness and tingling. This should not happen. That's why it's very important to maintain that 30-degree elbow flexion. Okay. If you selected letter A, the patient elbows are flexed 15 to 30 degrees when using the crutches. This is the ideal elbow flexion. If you selected letter B, crutch pad is approximately 2 inches below that patient's axilla. Yeah, recalling about the standard, this is one of those. If you selected letter C, patient holds the cane 4 to 6 inches to the side of her foot. Yeah, kind of about leery about the 4, but since there's that 6, so we'll keep it. So the positioning of the cane does not typically contribute to the numbness of or tingling of the upper body. This is more about the balance and the pressure. So what we need to do here in this test question is to eliminate those options that do not really relate to the patient's reported symptoms. So you got to focus onto the mechanics of the use of the crutch and how to properly position themselves. Let's have number 15. A primary healthcare provider prescribes a standard walker for a client who has weakness on the left side and needs help with balance, but is capable of bearing weight on both legs. What should the nurse instruct the client about using the walker safely? Select all that apply. A, move the strong leg forward last by itself. B, lift the walker before moving it forward a foot. C, move the walker and the weak leg forward together first. And D, set the walker height to align with the hip joint. And E, push the walker a comfortable distance ahead before stepping forward. Take note, your patient has weakness on the left side. They're about to use a standard walker. When we're talking about a standard walker, it doesn't have the wheels, okay? Take note about that. We're talking about the standard walker. So your answers here should be letters A and C. Move the strong leg forward last by itself. Because when you're doing this, this will allow the affected leg to bear weight while providing support through both arms on the walker. So this will also ensure much more balance and safety. Now, if you selected letter C, move the walker and the weak leg forward together first, it will allow the patient to bear weight on the affected leg, and it will also promote stability and reduce the risk of falls. So take note into the question again. If you've missed, it said something about but is capable of bearing weight on both legs. Do not forget this section. Patient has weakness on the left side, but can bear weight on both legs. That's why we have all those two options. Now, why not letter B? Lift the walker before moving it forward a foot. Lift the walker before moving it forward a foot. Remember that the appropriate distance to advance the walker is about 6 inches, not 12. So if you're allowing the patient to advance the walker farther, this can lead to the loss of balance, because this will require really the patient to reach beyond their stable center of gravity. So this is way too much of a distance between the body and the walker. 12 inches. It should be only 6 inches forward. Now, if you selected letter D, set the walker height to align with the hip joint. No, that should not happen. The walker should be adjusted that it's only slightly below the waist. It should not be aligned with the hip joint. Okay, so this is not going to allow the patient that proper posture. They're not going to be able to grasp the handle if you're going to do this height. This is way too much of a height. Now, if you select letter E, push the walker a comfortable distance ahead before stepping forward. A comfortable distance. Take note that when we're talking about the standard walker, it doesn't have wheels. So if you're going to instruct them to push it at a comfortable distance is somewhat vague, and it could lead to the assumption that they can just do it without even thinking about the danger of the instability. So again, think about the distance, which should be about 6 inches at a time to maintain that stability. Make sure that they are able to maintain that center of gravity. So they should not move the walker 12 inches forward. Now let's have number 16, which I believe will be the last item. A nurse is preparing to teach a client with hemiparesis how to use a cane. What instruction should the nurse provide? Select all that apply. A, step forward first with a weak leg, then the strong leg and cane. B, adjust the cane height to be 12 inches lower than the waist. C, hold the cane in the hand opposite the weak side while walking. And D, look down at the feet while walking with the cane. And D, and letter E, lean on the cane while walking. Which of these options? Your answer here should be only one. That is letter C. The cane should be held by the strong hand. It is an assistive device that's supposed to provide support to the weak side. The rest of them are incorrect. So let's take a look into letter A. Step forward first with a weak leg, then the strong leg and cane. This is exactly the exact opposite of what I just spoke to you earlier about the proper sequence. Right? The weak leg should not, what should happen here instead? The unaffected leg should be moved forward before, because it can better support the body's weight. So this approach will, hang on a second here. Step forward first with a weak leg, then the strong leg and cane. Again, remember about the use of the cane first. You're going to have to use that first, and then actually use that first, the cane to be used on the unaffected side. Remember, your cane should be held onto the unaffected side, while the affected side will step together, right, with the cane. Now this will be followed by the unaffected leg. So this is not describing that ideal sequence. Now let's have letter B. Adjust the cane height to be 12 inches lower than the waist. What we should have is that the cane's handle should be positioned at the level of the greater trochanter, okay, which is approximately about 6 inches to the side of the foot. So this will ensure about 15 to 30 degrees below, or 15 to degree angle. So this will promote comfort. Again, this is way too much of an adjustment here. Now let's have letter D. Look down at the feet while walking with a cane. This can disrupt the proper posture of the patient and also disrupt their balance. So to make sure that they have an upright body alignment, they need to not look down. Make sure that they're gonna look forward, not look down. Now for letter E, lean on the cane while walking. If they're heavily leaning on the cane, this is not advisable. What the patient should do here is to maintain a balanced posture, to evenly distribute the weight between the feet, the unaffected and the affected leg, to make sure that the cane can promote much more of a stability. So not just relying on the cane. So the body weight should be evenly distributed while the patient will take a step. So your strategy here in answering number 16 is to recall again the concept about the proper sequence when using the cane. Eliminate those options that will decrease the stability of the patient's gait. Now, before we're going to end the session, let me go back into what we had yesterday regarding the item number 8 and 9. I'm sure that some of you guys didn't really understand about the reasoning why in item number 8 we're using the there was something about the use of warm water baths. It's not really the answer. It said here, recommend using lukewarm warm baths. My rationale for that one yesterday that it is incorrect is because they should be using the warm water for baths, right? Especially if they have a new diagnosis of the rheumatoid arthritis. It is really beneficial for this patient, especially if they have RA. They need to have the warm baths, especially if they're worried about stiffness, if there is any pain, which is pretty much like gonna happen in their daily lives. It's not just gonna happen like every 2 or 3 days. No, they're gonna experience the stiffness and pain every day. And so I mentioned something about using warm baths as one of the soothing techniques to allow mobility. That is correct, right? And if you were confused about this option right here, especially in question number 9, take note that the situation stated about an exacerbation of rheumatoid arthritis. And the question had these options, like applying cold packs before exercising to reduce pain. Why is this correct? Well, the reason why the cold packs will be appropriate this time, it's because this can help numb the area, especially if the patient already has significant swelling into this joint. Take note that we are in an exacerbation period, right? This will help numb the area. This will also reduce the swelling, and this will facilitate the patient's exercise, right? Because if we are going to use a warm pack here, this will worsen because the blood supply will be increased into that area where the swelling is already occurring, okay? Now, again, the main difference here is because the patient has an exacerbation of the rheumatoid arthritis, we're not just worried about the stiffness and the pain, but we have also the factor that the patient has to undergo some form of activity, such as an exercise, and it has that benefit that the cold compress or packs can actually numb the area. Again, the rationale for that is to reduce swelling. It will also numb the area, okay? And this is much more appropriate, again, in exacerbation periods or whenever there is rheumatoid arthritis flare-up. So I hope that clarifies the confusion that we had yesterday regarding the cold and heat application. Even though both can be beneficial, but our concern here is about the exacerbation period and the patient's involvement in proceeding with the activity. Okay, so The correct answer for this is letter A, apply cold packs to reduce pain. So for the answers from yesterday, nothing has changed. I'm just trying to clarify the rationale why we're using cold packs for this case scenario in number 9. So I thank you for your time. I hope that you had learned something from today's session. And I'll see you again probably in the next 2 days. We'll tackle on the management of burns. And then lastly will be the sepsis. And hopefully we're going to have some more sessions after that. So thank you again for your participation. I hope that you enjoyed the session. And please don't forget to hit the like and subscribe buttons and share this with your friends who are also reviewing for the NCLEX. Again, thank you, and you all take care. Bye-bye.